Hi everyone, welcome back to SG Doctor Wellness. My name is Dr. Chen Yiming. As we speak, the COVID-19 virus is still spreading rapidly across the world. The risk of severe disease and death has been the highest in older people and in persons with underlying chronic conditions such as cardiac disease, chronic lung disease, and cancer. Thankfully, the condition is largely mild in children, even though COVID-19 vaccination for children under the age of 12 has not begun in most of the world. However, as of mid-2020, clusters of children in Europe and North America have been reported to require ICU care with a multisystem inflammatory condition due to COVID-19 that bears some resemblance to Kawasaki disease and toxic shock syndrome. This condition is now known as Multisystem Inflammatory Syndrome in children associated with COVID-19, or MISC for short. If you are a parent and you haven't heard of this condition, make sure you watch till the end of this video, and I will be discussing the diagnostic criteria for the syndrome and what are the signs and symptoms to look out for that should prompt you to bring your child to the emergency department or nearest doctor. As the number of cases of children diagnosed with COVID-19 in Singapore rise, we will start to see more cases of MISC. And if you are new to our channel, click on the subscribe button now. Multisystem inflammatory syndrome in children is an uncommon illness that can occur 2 to 8 weeks after the initial COVID-19 infection. The incidence of MISC has been reported to be about 0.14% among children with COVID-19 infection, and in Singapore, as of 9th of November 2021, a total of 5 cases of MISC were reported to MOH. Both the CDC, Center for Disease Control and Prevention, and WHO, World Health Organization, have published diagnostic criteria. This is the diagnostic criteria from CDC. Basically, it means that we need to suspect MISC in someone younger than 21 who has been tested positive for COVID-19 within the past 4 weeks, presenting now with fever and multi-system organ damage that has no other plausible explanation for the signs and symptoms. This is the diagnostic criteria from WHO, of which Singapore is currently adopting. It lays out more specific pointers which are easily identifiable. If you're aged 0 to 19 with evidence of current or recent COVID-19 infection, high fever of 38.5 degrees Celsius for more than 3 days, various signs and symptoms of each organ system involvement, elevated markers of inflammation in the blood such as CRP and procalcitonin, excluding other sources of bacteria or viral infection. Now, this diagnostic criteria may seem very confusing to you, and therefore I will attempt to summarize some of the salient features that you should be looking out for as worried parents. If a child younger than 19 years old has been diagnosed with COVID-19 within the past 2 months, and if he or she developed a sudden fever of more than 38.5 degrees for more than 3 days, you must be careful if your child is also having lethargy, drowsiness or confusion, headache, red and swollen eyes, red and swollen hands and feet, rash on the body, shortness of breath, chest pain, abdominal pain, vomiting, or diarrhea. There are treatments available for MISC, and thankfully most children recover from it. At this point, the medical world is still not sure why it occurs and how it occurs and which kids will get it. And there are evidence which suggests that a small proportion of these kids may get long-term heart complications. But what is important is for all parents to know about MISC and to know what to look out for so that you can bring your child to the doctor as soon as possible. Early diagnosis gives you better recovery. So share this video with all worried parents. I sure hope this was helpful for you. Click on the subscribe and notification button. Until the next time, stay safe, stay healthy.